Does memory decline with age? Seems like a pretty straightforward question, because it stands to reason that if we decline physically with age, we should decline cognitively in tandem. But it's a little more complicated than that. Generally speaking, our most accessible memories at the end of our lives tend to be those formed between our late teens and early 20s, which makes sense. This is usually a period in which life-defining events occur, and when we experience a lot of things for the first time in our lives. But it also seems to be when our memory is at its strongest. In tests of recall, young adults prove to be more proficient at remembering personal details about other people than septuagenarians. Even so, most people who live into their 90s do so with relative lucidity. Others suffer substantial psychological decline that, while it does worsen with age, isn't experienced by everyone at the same stage of their lives. Among older adults, hearing loss and social isolation increase the risk of depression and subsequently mental decline. Compared with people with good hearing, those with hearing loss show declines in memory, attention, and learning about 3 years earlier. A series of small strokes, a brain tumor, heavy smoking, or alcoholism are all especially damaging to the brain in late adulthood, causing that mental erosion that you might know as dementia, though the term has been generalized to neurocognitive disorders as of the publication of the DSM-5. Mind you, because the terminology has been updated to be a bit more general, the term neurocognitive disorder can apply to delirium induced by any number of things, and not just in the elderly. Prion disease and HIV, for example, both of which can be contracted by an individual of any age, cause the kind of brain damage associated with neurocognitive disorders. One of these neurocognitive disorders is Alzheimer's disease, which occurs when proteins like amyloid cause plaque to build up in and around brain cells. Alzheimer's affects 3% of the world's population by the time they're 75. Up to age 95, the chances of developing Alzheimer's double roughly every 5 years. Alzheimer's patients first experience memory deterioration, then their reasoning worsens. And as the disease runs its course, which could take anywhere from 5 to 20 years, the person becomes emotionally flat, then disoriented and disinhibited, then incontinent, then finally mentally vacant. Unlike other neurocognitive disorders, your chances of Alzheimer's are increased through genetic predisposition, in a gene called ApoE4, of which one copy is carried by 1 in 4 people, although a select few carry 2 copies from both of their parents. One of these people is Chris Hemsworth, who decided to take a break from acting after discovering that he carried 2 copies of the gene. There is some good news though. Long before symptoms appear, new technologies can now test for the ApoE4 gene or check spinal fluid for fragments of amyloid and other proteins, and these discoveries have motivated the scientific community to develop treatments for Alzheimer's. In people at risk of the disease, brain scans have also revealed, before symptoms ever even appear, the degeneration of critical brain cells and diminished activity in Alzheimer's-related brain areas. Alzheimer's is somewhat less common among those who keep their minds and bodies active, through activities like reading, attending educational lectures, and running or lifting weights. So if you find that you're genetically predisposed, or just want to keep your mind active as you circle the drain of eternity, it might be a good idea to keep your body active as well. So, does memory decline with age? It certainly can, but the good news is that we seem to have more control over our mental decline than our physical decline.